Continuing the news, starting or adding to a family can be a happy time for couples, but it can also be one of the most dangerous. Black women in the United States are 3 times more likely to die from pregnancy-related complications than white women. In this Eye on Health report, Latrice Curry talks with a local OBGYN about the black maternal health crisis.
Being black and pregnant can be a risky combination. Healthcare professionals and advocates say there is a black maternal health crisis across this country.
Black mothers are 3 to 4 times more likely to die from pregnancy-related complications than whites.
Dr. Tiffany Few is an OBGYN at Women's Institute for Health at Erlanger. She says even more disturbing, most of these deaths could be prevented.
What's most devastating here with this whole disparity is that up to 80% of these deaths are considered preventable.
Some of the key factors that contribute to this black maternal health crisis are lack of access to quality health care, underlying chronic conditions, structural racism, and implicit bias.
It's a sad fact, but it's true. Black women in the country are often underrated in the medical community and elsewhere, aren't listened to the same, aren't valued, aren't respected the same way.
There are some very unfortunate examples of that. Charles Johnson lost his wife, Kira Johnson, in 2016 after she gave birth to their second child. He says they did everything right, from making sure she was taking all her prenatal vitamins to going to a top-notch hospital. But it still wasn't enough. He gave an emotional testimony on Capitol Hill 2 years ago in May of 2021 when the House Oversight Committee held a hearing on the black maternal crisis.
Lack of compassion and lack of humanity that failed my wife and is failing black mothers time and time again.
Aziza Balzar-Clark says she was exhausted during her first trimester, but her concerns weren't taken seriously. This is what her doctor told her.
Of course you're tired, you're pregnant. And me, this is my first child.
Her doctor dismissed her concerns.
But I see some people who are so relieved that I listen.
Aziza's situation got worse. She was dangerously anemic and had to have infusions. Thankfully, she and her baby both survived a horrifying ordeal.
So it doesn't matter, celebrity, income, status. As a black woman, there's a disadvantage there.
A disadvantage that not only doctors but also lawmakers need to address.
Insurance, Medicaid needs to be increased, paid time off. We have to do better about funding and supporting programs that work toward improving this outcome. We have to talk about education. Right now we're so focused on pro-life, but we need to be focused on pro-maternal health.
Then there are health concerns like pre-existing conditions, hypertension, diabetes, obesity, and depression.
But pregnancy is not going anywhere. This issue isn't going anywhere. So I hope that we can use this and make real change for the future.
Latrice Curry with that report. The White House issued a proclamation for Black Maternal Health Week last month.